Welcome back to the Dr. Rich channel. Today it's urology versus gynecology. Dr. Spier and myself will debate the vasectomy versus tubal ligation and find out which one is better. Hi, I'm Dr. Rich, and my passion is to provide every woman with practical knowledge about the world of women's health. Now, every day in my practice, I'll have patients ask, is it better for me to have a tubal ligation, or should I send my husband to urology for a vasectomy?
Well, first of all, thank you for having me. I look forward to educating your audience about the pros and cons of tubal ligation and vasectomy, and I really do hope you brought a large knife to this gunfight.
Game on. So since Dr. Spier, you're my guest, I'll let you go first. What
Perfect.
are your top reasons?
Great, I think we start with simplicity. I think when a gentleman comes to see me who is looking for a vasectomy, usually it's the wife that's pushing him in the door, number one.
That's true.
It's always the wife. But as far as the procedure itself, it's done in the office under local anesthesia with options. There's nitrous oxide, which is a gas that the patient actually can hold and kind of puts them in a comfortable place. It's anxiety provoking no matter how you look at it. Patients are going to be nervous. I tell them all, if you're not anxious, you're not normal. But the simplicity of the procedure, it's about an 8 to 15 minute procedure. It's under local anesthesia and the patients do great.
Well, I mean, certainly local anesthesia is going to be less invasive and there are going to be fewer complications than anybody who has to have a general anesthetic as you do for a tubal ligation. Now, the only argument I could have against that is some patients don't want to feel any pain, they don't want to feel anything, and the standard of care practice for tubal ligation, no pain, total anesthetic in the OR, versus the trepidation or the fear that's going to come with men that don't have that luxury, although as you mentioned, there are other adjuncts besides just local anesthetic.
Yeah, and so my rebuttal to that, really, it's all about communication. You know, we have a big group of urologists. We pride ourselves on counseling the patient, sitting them down, having a pre-procedural consultation, and try our best to make them feel at ease, because ultimately, you know, they're Googling stuff, they're talking to friends that have never had it, and it's all about education. And once I feel like they have the right data and education about the procedure, it really is pretty seamless.
So that's a great point. What would be the second reason?
I think the second reason's got to be safety. You talked about going to the OR under anesthesia. We worry about side effects and obviously complications. With a vasectomy, the complication rate is about 1% to 2% in the literature. It's very rare. Some men have some pain afterwards that can last maybe upwards of a week or two, some long term, but it's few and far between. In fact, I don't remember the last patient who was really complaining for over a long period of time. So I think from that standpoint, not having to go under anesthesia where there's potential for complications and damage to surrounding structures. You've got this tube that only transports sperm. That's all it does. We're taking a segment out and closing it up with a suture, and they do very, very well. So I think safety is something that everybody has to take into consideration.
Well, that's hard to argue with. Any surgical procedure is going to have some risk that's specifically associated with that procedure. There could be bleeding even with an office-based procedure. But these risks are increased when you're talking about going to the operating room for a tubal ligation and actually having to make incisions on the abdominal wall to place a camera. There are separate risks also for general anesthesia. Fortunately, general anesthesia is very safe and the overall complication rates are very low. I think just the magnitude of the complication that could occur are very rare on either one, but potentially greater in the OR. So I didn't give you much to debate there, but I think it is pretty clear that when you can do an outpatient procedure, it's going to be safer.
Sounds like I took that one there, Dr. Rich, and your knife certainly is not that big in this gunfight, so we shall move on to the next topic.
But keep watching.
So the third point that I have to basically argue for the vasectomy is expense. Everybody obviously cares about their pocketbook. When you do a comparison to tubal ligation, The cost is probably about 1/5. The other important point is everyone has to understand that there's a cost just in general for the general public and just medicine on a whole as far as the cost of medicine. And so, when you're being admitted to a hospital and you're using different methods to do surgery, you're looking at a major cost. As far as that goes, I feel strongly that is a major consideration that patients have to keep in mind.
Yeah, cost is very important. Now, for the patient, whether vasectomy or tubal ligation, most insurances, this is going to be a covered benefit, and it would just be a matter of meeting the co-insurance and the deductible for the procedure. And that's going to be pretty similar for either one. Now, the absolute cost, as Dr. Spier pointed out, is going to be a multiple, like maybe 5 times more for the tubal ligation, but the patient's not going to see that expense. Now, as a 30,000-foot view for global healthcare cost, if we can save money for the system, there'll be more money left available for other needs, other research initiatives, and it's a very personal choice. But for the patient themselves, their out-of-pocket expense, in my experience, is similar and usually covered by insurance.
Well, I would argue that there's going to be a copay, and I think it's also based on the total cost of the procedure itself. So, again, trying to be a steward for the general health care, I think we have to take that into consideration and try our best as a general public to not waste costs and waste resources. So I think it's something to consider.
Thanks for sticking around until the end. If you found this valuable, please subscribe and share. And join us for our next video when we talk about the benefits of tubal ligation compared to vasectomy.